Nurses dispense comfort, compassion, and caring without even a prescription. This quote by Val Sainsbury rings true for nurses all over the country and the world. Nurses labor tirelessly and do some of the most important medical work when caring for the sick, the injured, and the disabled. Nurses are an essential part of the medical field, and we have all encountered one at some point in our lives. First, I'll discuss the history of the nursing profession. Then, I'll discuss 5 different types of nurses. Nurses care for the sick, the injured, and the disabled. These medical professionals provide medical treatment and patient care. Nurses work with physicians and sometimes independently. Prior to the development of modern medical facilities as we know them today, when sick or injured, most people were taken care of at home by family members. This is due in part to the fact that nursing was not acknowledged as an actual profession. Prior to the 1800s, nurses didn't do much medical work. Physicians had women to assist them with menial tasks such as washing dishes, cleaning floors, and serving patients food. When the American Civil War broke out, the need for nurses to give medical treatment increased drastically. There were so many injuries that needed tending to. Doctors had no choice but to rely on nurses to assist them in providing medical treatment for the sick, the injured, the disabled, and dying soldiers. By the 1900s, there were over 400 nursing schools in the United States alone. Yet prior to 1903, nurses weren't even required to graduate from nursing school. There are currently over 3 million registered nurses nationwide today. There are many different types of nurses with a variety of different duties. I will talk about 5 different types of nurses. First, a registered nurse, or RN. This is the most common nurse. Registered nurses graduate from a nursing program and have met all the requirements from the state that they reside in. They assist doctors in hospitals or other medical environments. They have many duties that involve patient care, medical treatment, medical planning, case management, and much more. Second, a licensed practical nurse, or LPN. A licensed practical nurse, they require less training than an RN. They're given less responsibility. However, they do perform medical duties under the supervision of a registered nurse. Third, a travel nurse. A traveling nurse performs duties such as a registered nurse. However, they work in temporary jobs, mostly in hospitals. They travel nationally and internationally as needed. Next, a home health nurse. A home health nurse performs medical duties in the patient's home. They work with mostly geriatric or pediatric patients who typically have mobility issues. Lastly, a school nurse. A school nurse performs medical duties and are typically required to have the same training and certification as a registered nurse. However, they work on the campus of a school. They cater to minor illnesses and injuries with students and staff. Nursing is a much needed profession. The medical industry would greatly suffer without the hard work and dedication of nurses. From professional nurses dating back to the 1800s to the vast 3 million plus nurses working today, everyone has had some dealing with nurses in life. Nurses have many medical duties and work extremely hard to take care of the sick and injured patients. They deserve much appreciation. They do more than simply administer medical care to the patients they serve. They provide emotional support to families. They advocate for those who don't have a voice. They work long hours to ensure their patients are given the best care possible. And most importantly, many do all of this without complaint and minimal appreciation. Nurses are the heartbeat of the medical field and the heroes of our healthcare system.